The remix, man. Tony Braxton and Missy Elliott, do what you need to do. 27 minutes. I'm sorry. The hell am I looking at? Oh, we got Dr. MJ Collier. Dr. MJ Collier, good morning.
Good morning, Rickey, Smiley, and I hope you had a great holiday because the coronavirus didn't take one.
It sure didn't at all, man. And the numbers are skyrocketing.
The numbers are skyrocketing. You know, it was May 20th when they started lifting restrictions on all the states, and that was when we had blunted the curve and stopped the increases, and cases were down to less than 2,000 per day. And now they have skyrocketed, and yesterday we had 49,000 new cases. But last week we topped that. We had over 50,000. So the numbers are increasing. And now the actual numbers, I believe, to be much higher, but due to a couple of factors. One, there's a testing shortage still, and then many cases are unreported to this date. So the United States now, we're number one. We've become the worst affected country since we reopened up, and worldwide now we are exceeding, even though we have underdeveloped countries or even third world countries that are doing much better with this coronavirus than we are doing. So that is a real problem. The U.S. has been, growing because of the relaxed restrictions now. And guess what, Rickey? The New York Times came out with some new federal data that shows we already were aware of this, but this is hard research data now, that Blacks and Latinos are disproportionately affected across the United States, not just in certain areas. It can be urban, it can be suburban, it can be rural, and we still are 3 times more likely to become infected than our white counterparts and twice as likely to die from the virus. So this is impacting us as a people without question. And, you know, what we're finding now, too, is that some of these people are not getting over the disease in 2 weeks. This is not just a respiratory virus now. It is a total body assault. And individuals are having extended periods of time, months and months, and they may require treatment subsequently. So they're using a couple of drugs. We know about remdesivir, and they have another one that has been used for the treatment of HIV previously. And they're doing studies treating people who have not recovered from their symptoms after, a few months, and they're treating them and getting great responses from them. So that's where we are with the coronavirus now. We don't have any breakthrough treatments, of course. We still don't have a vaccine, but the remdesivir, which is giving some benefit, is in very, very short supply now. A lot of hospital systems have run out of that treatment. So, and now they're just getting to the point where the illnesses and the death rates are going to increase, and it's going to overwhelm our healthcare system.
Oh, wow. Dr. Collier, so do you think that they're going to shut everything back down like it was, when the coronavirus first came out, or is that what they need to do? What do you think?
I think they're going to have to start implementing. Most states have that are having increased in their rates have slowed down, if you will, and limited their reopenings and even backed up somewhat. But we're worse now than we have ever been, and that's being considered. But our leadership from the top is not telling us that's what they want to do. They still, I state unequivocally, there seems to have been a conscientious decision to just let this happen, and those people that are going to get sick and die are going to get sick and die, because we're just not doing anything that would treat them in the appropriate manner to stop that from happening. And so we are, I'm flabbergasted as to why this is happening. But the science and what's being recommended by the Centers for Disease Control and the World Health Organization is being totally ignored by those in leadership. And you're just saying, go out and do, be happy. People are going to get over it. I think you heard your president quoted this week as saying most 99% of the cases are mild and have no consequences, even though, the death rates are now going back up as well. I have to say that the case rates have shot up exponentially. The death rates are not so much as of yet. Part of that is that we know much more about it now. We can treat people more effectively, even with the conservative therapists that we have, and they are actually treating people and not just saying go home and self-quarantine for 14 days. So they're aggressively treating people, even with mild cases now, because, they're seeing what's happening. But that is impacting the death rate. But how much is enough? How many people dying is enough? That's the question. We had 242 people die in the United States yesterday.
Right.
If it was somebody you know and love, you'd be a little disenchanted with that process.
Right. Dr. Collier, let everybody know how you can be reached for more information on COVID.
Okay, for more information on COVID, you can reach me on my website, lifodrops.com, where we have a page specifically talking about boosting your immune system. And again, these are the opinions of Dr. M.J. Collier, not those of the Rickey Smiley Morning Show or its radio listening affiliates.
There it is, y'all. The one and only Dr. M.J. Collier, y'all. Gary got the tea in the floor today. Coming up, Rickey Smiley Morning Show.